Hi, my name is Giesey. I'm a nurse practitioner at Genesis. I do work at the New Concord Family Practice. I have been with Genesis since 2008, and I have been a nurse practitioner since 2017. A nurse practitioner basically does most things that a provider as a physician can do. We do see patients on a regular basis to cover basic overall health. So we look at the patient from the whole picture. We look at preventative care and we look at treatment and follow-up treatments as well. When I was in high school, I always wanted to be a nurse. I went to get my associate degree in nursing. From that point, I did go and get my bachelor's degree. From that point, I did start working at Genesis, and I was working as a floor nurse. From that point on, I decided it was time for me to go on and get my nurse practitioner. So I have now been working as a nurse practitioner since 2017, and I have loved every aspect of it. To be a nurse practitioner, you do have to start at the level of becoming a registered nurse. From a registered nurse, we do continue our education with either 2 more years of college or an additional 4 more years to either get your master's or your doctorate of nursing. From that point on, we do a lot of clinical rotations. We do specialized areas. We work in practices of women's health, gynecology, the geriatric population. We do try to cover a full broad spectrum on all of the healthcare. Nurse practitioners have education and training for prescriptive authority to where we are able to prescribe medications to treat our patients based on their specific needs. Nurse practitioners and providers do work side by side to take care of the patients to their needs. Nurse practitioners do have the capabilities to practice independently. I myself do practice independently. I do reach out to my collaborating physician if there are any complex cases that I may want to run something by her. For those of you registered nurses who have really contemplated whether to go on and get that additional education to become a nurse practitioner, I say do it. Do it for yourself. Do it for our patient population. The healthcare is growing. The need for us is growing. And we do have that independent ability to practice to provide those patients with the care that they're needing.